Hello, and welcome to another episode of Healthcare Insights by Health Innovator. I'm your host, Hamid Mahmood. And in today's episode, we're going to be talking about a very important topic in the U.S. healthcare industry called prior authorization. Prior authorization is a process where doctors must get approval from health insurance companies for certain treatments, procedures, or medications are covered. Sounds reasonable, right? Well, not when it takes weeks or even months to get a decision. Prior authorization has been a major headache for doctors and patients alike. It causes delays, increases paperwork, and often even prevents people from getting the care they need. Additionally, prior authorizations are a controversial topic because they often lead to member displeasure due to denials by the health insurance company, which can sometimes lead to frustration, anger, which turns into protests, and even deadly violence and murder, like in the case of the CEO of a large health insurer who was murdered quite recently in New York City. We're going to explore prior authorizations in detail in this two-part video. In this first part, we will discuss why are prior authorizations needed, the end-to-end process of prior authorization, decision-making approvals and denials, and impact to members and providers. So let's talk about why are prior authorizations needed. Prior authorizations are required by health insurance companies to ensure that medical treatments, procedures, and medications are necessary, cost-effective, and appropriate for a patient's condition. Here's a detailed breakdown of why prior authorizations exist and how they impact healthcare. Firstly, ensuring medical necessity. Insurance companies use prior authorization to confirm that a recommended treatment or medication is medically necessary. This prevents unnecessary procedures and ensures that patients receive evidence-based care. For example, if a doctor prescribes an expensive medication, the insurer may require proof that cheaper alternatives have been tried first. If a patient needs an MRI scan, the insurer may check whether a less costly X-ray or ultrasound would be sufficient. Second factor, controlling healthcare costs. Prior authorization helps insurers manage costs by preventing overuse or misuse of medical services. Healthcare expenses can skyrocket when unnecessary tests, procedures, or medications are prescribed. By requiring approval, insurers reduce wasteful spending on treatments that may not be effective, ensure that generic drugs are used instead of costly brand name medications when possible, prevent duplicate tests. For example, if a patient had a CT scan recently, the insurer may deny another unless medically justified. Aligning requested services to the patient's currently selected medical health insurance plan. This is a major problem because when purchasing plans, health insurers do not provide a detail-level benefits guide or information. This information is stored in an insurance company's legacy system and is very hard to extract and publish. But that's no excuse. With the help of modern technology, this can be easily achieved. Making detailed benefit information available to patients at the time of buying the insurance plan is extremely important, and allowing continued access to this information is even more crucial to ensuring member education. This way, even before a prior authorization is submitted, member and provider both know what to expect as a decision, and there's no guesswork. Another factor is preventing harmful treatment. Some medications and procedures have serious side effects or risks. Prior authorization ensures that a treatment is safe for the patient. For example, certain high-risk medications require approval to confirm that the patient does not have contraindication. Procedures like surgery may require prior authorization to verify that less invasive options have been considered. Regulating high-cost medications is another factor. Many specialty drugs used for conditions like cancer, autoimmune diseases, or rare disorders are extremely expensive. Insurers require prior authorization to confirm that the medication is appropriate for the patient's diagnosis, the patient has tried other treatments before moving to high-cost options, the dosage and frequency are within recommended guidelines. An additional factor is preventing insurance fraud and abuse. Prior authorization helps prevent fraudulent claims and overprescription of medications. Without this process, there could be overuse of controlled substances, for example, opioids, billing for unnecessary procedures to increase profits, duplicate prescriptions that could lead to medication misuse. Another factor is improving healthcare efficiency. While prior authorization can be frustrating, it also helps streamline healthcare by ensuring that treatments are aligned with best practices. Some insurers are now moving towards electronic prior authorizations to reduce delays and paperwork. Now, let's talk about the end-to-end process of prior authorization. Prior authorization is one of the most frustrating aspects of healthcare, and I'm going to take you through a real-world example of what happens behind behind the scenes when a family tries to get approval for essential therapy for their child with autism. Buckle up. This process is more complicated than it should be. Imagine this. A child has just been diagnosed with autism. The doctor prescribes ABA therapy, speech therapy, occupational therapy, and more. But before any of these services can begin, the parents have to get approval from their insurance company. And that's where prior authorization comes into play. The provider organization providing the therapy collects several pieces of information, which includes the official diagnoses, any assessment documentation that has been conducted, clinical test results, any additional details required by the insurance company. Sounds straightforward, right? Well, here comes the first issue. This information is typically faxed. Yes, faxed. In 2025, we're still relying on outdated, inefficient systems that slow down healthcare approvals. Many times, fax machines malfunction or only receive partial fax, thus creating rework. Once the insurance company receives the request, a certified nurse trained to handle such prior authorization requests reviews it. They check for two main things: medical necessity. Does the child truly need these therapies? Secondly, benefit coverage. What does the family's insurance plan actually allow? Here's where things get very tricky. Even if the doctor says therapy is needed 6 times a week, the insurance plan might only cover 3 times a week. So the nurse may issue a partial approval, not for the full 6 sessions, but only 3. This leaves families struggling to fill the gap. This is where providing upfront detail of the plan coverages is extremely crucial. If there's not enough proof to justify the services, the request is denied. A doctor, an MD, then reviews the nurse's decision and makes a final determination. If the denial stands, the provider receives a formal denial letter by physical mail. That's right, not an email, but an actual printed letter. And here's something even more frustrating. You can be denied for any reason, even something as minor as missing a check mark on page number 19 of the required documentation. You now must resubmit everything, go through the entire process again, and hope that it works. And yes, that means faxing everything all over again. When the parents finally call the insurance company, they're told the services were approved, but only up to the limits of their plan. And that's when they realize something shocking. When they enrolled in their health plan, they were given only basic benefit information, a high-level summary, not a detailed breakdown of what's actually covered. If there were more transparency up front, they wouldn't have been caught off guard. And here's the kicker. Some therapies require prior authorization every year, some every 6 months, and some even every few months. That means families have to go through this entire process over and over again just to continue care. At the end of the day, insurance companies are controlling costs instead of prioritizing patient access. If the system built to be clear, efficient, and transparent, families wouldn't have to fight so hard just to get the care they need. Now let's talk about some of the negative impact to members and providers on the prior authorization process. Prior authorization, 2 words that strike fear into the hearts of doctors and patients alike. It's supposed to ensure appropriate care, but in reality, it's a nightmare that delays treatment, frustrates providers, and leaves patients suffering. We're now going to expose the negative impact of this broken system. Doctors spend hours filling out paperwork, making phone calls, and fighting for their patients. And patients, they're left waiting, sometimes in pain, sometimes with life-threatening conditions, while insurers decide whether they deserve the care their doctor already prescribed. Let's talk about some real-world consequences. According to the American Medical Association, 94% of physicians say prior authorization causes delays in care, and nearly 1 in 4 doctors report that these delays have led to serious harm for their patients. Imagine being diagnosed with cancer and your doctor prescribes a life-saving treatment, only for your insurance company to say, "Hold on, we need to review this first." Days turn into weeks, and suddenly your condition worsens. This isn't just frustrating, it's dangerous. Doctors didn't go to medical school to fight insurance companies, but that's exactly what they spend hours doing every week. Prior authorization is a massive administrative burden, taking time away from actual patient care. A survey found that 87% of physicians say prior authorization increases waste and reduces efficiency, and more than 1 in 4 requests are denied outright, forcing doctors to appeal or resubmit paperwork. Here's the worst part. Many denials happen because of technicalities, not medical necessity. A missing checkbox, a wrong code, or simple clerical error can mean weeks of delays for a patient who desperately needs care. Let's talk about the money. Insurance companies claim prior authorization helps control costs, but at whose expense? Patients are forced to pay out of pocket for treatments while waiting for approval, and doctors spend thousands on administrative costs just to navigate the system. Meanwhile, insurance companies are improving their financials while patients are left struggling to afford care. So, what's the solution? How can we improve this process and provide greater control to members and providers? Health Healthcare advocates are pushing for electronic prior authorization, faster response times, and greater transparency. Some states are even passing laws to limit the use of prior authorization for essential treatments. We will be discussing those areas in the next upcoming video on prior authorizations. If you have struggled with prior authorization, share your story in the comments. Let's make sure patients and providers don't have to suffer because of a broken system. That's it for today's video. If you found this helpful, hit that like button, subscribe, and let's keep the conversation going. Together, we can push for a better, fairer healthcare system.